time to be well with your health. I'm Nimit.
And I'm Tina.
Welcome to Adventist HealthCare, a new podcast.
Today, we have a special guest host with us. You may recognize her from past episodes. It's great to have you back, Tina.
So happy to be here today, pinch hitting for Shanna.
Yeah.
And during Breast Cancer Awareness Month. Such an important topic. I know I've got my mammogram scheduled, and Shanna did a great public service. She took cameras along with her to have her mammogram done this year. And I know that there's a link where people can view that on YouTube. We just want to demystify that process. So if it's your first time going in for a mammogram or you're approaching that time and you kind of want to walk through it, you can check out Shanna's video and see exactly what the process entails. But we've got our expert here that's going to kind of help us dispel some myths, right, Emmett?
Yeah, absolutely. And my mother went to get a mammogram a couple of weeks ago. She had a lot of questions, so I'm very excited about today's talk. We have Dr. Nikki Terada, who is a radiologist. She's the director for women's imaging at Adventist HealthCare. Welcome, Dr. Terada.
Hi, thank you for having me.
So why don't we get started, Dr. Terada? Can you just tell us about what is a mammogram?
So a mammogram is a tool that we use to detect early breast cancer. We can see a cancer on a mammogram way before you can feel it. So it's just low-dose X-ray to take a picture of your breast. The X-ray dose that we get from a mammogram is like a flight to California, so very minimum radiation. And the exam is only take about 10 minutes. Okay, the actual image acquisition take less than 2 minutes, but the actual appointment might take a little bit longer. So it's like something you can do between your lunch break even. It's a personal choice, but I think it's more important to know, we can treat it. Breast cancer is very treatable. Like we find it early survival rate for like early stage breast cancer, such as ductal carcinoma in situ, is almost 100%.
Wow.
So very good treatment available.
Right. And I recall from my own mammogram, there's some ground rules, right? So no deodorants, no lotions. These are all good tips. Why is that?
That's a great question. Normally, we give a patient a wipe to clear out the deodorant. So in the olden day, deodorant actually, some of them have like little talc or aluminum or something that we can actually see on a mammogram. It can mimic breast cancer because what we're looking for a little calcium deposit. So patient, if the deodorant that you use or a powder or something that have a little talc in it, it might show up. But right now, that is not as much a problem compared to the olden day because we do it in 3D. So we actually can tell it's located on their skin. But, it's nice not to have that anyway. So we always ask the patient just to clean up before.
I was always curious about that. So I'm glad to hear it from the expert.
That's great. And so when should women typically get that first?
As a radiologist, we follow the American College of Radiology recommendation. Also, American Breast Surgery Association also recommend that we start screening mammogram at age 40 for women with average risk.
And how often should they do that after that?
So we should do it every year. We believe that if you do a mammogram on a yearly basis, so we can find it earlier, we can treat you sooner.
That's great.
And what if you have a history of breast cancer in your family? How does that impact when you go for your initial mammogram and how you follow up?
So that's a great question because each patient are different. So if you're having a family history of breast cancer or ovarian cancer, you should talk to your primary care physician. There's a calculator. You can even do it online to calculate your lifetime risk for breast cancer. If your risk is greater than 20%, you might need additional study beside a mammogram.
So, when patients get the result for mammogram, what are the typical means? So if they're negative for the mammogram, does that mean they're all clear? And if if the mammogram shows something, does that mean they have cancer? So can you help our listeners understand what do the results mean?
Sure, definitely. So when you get a result of your mammogram, if it for screening exam, it can be just normal or incomplete. So we are not differentiated whether it's cancer or not cancer. So if it's normal, it can be letter 1 or letter 2. Letter 1 means we normally assign a different category from letter 0 through number 6. So if you get a normal result, negative result, it will come as a level 1 or 2. 1 means we do not see anything at all on your mammogram, just benign breast tissue. Number 2 means that we find some finding, but they're benign. Whether they're a little fibroadenoma, a little fibroid, or some benign cysts, which is a fluid-filled structure, completely benign, fluctuate with your hormone, or benign coarse calcium deposit. For your screening mammogram can be 1 or 2. If it's number 0, mean that we're not sure. We would like you to come back for additional picture just to get a little bit closer look. We might get additional mammogram or additional exam like an ultrasound. And you'll get that result the same day. A radiologist or her one our team member will come and talk to you and explain you for the result what are the next steps. So after you come back for your diagnostic mammogram, this will be your second visit with us. We'll get a result on the same day, whether it's number 1, number 2, which is nothing to worry about, or number 3, that we think that is, we don't believe it's cancer, but we'd like to see you back in 6 months, like a short-term follow-up. For that, the likelihood of being cancer is so small that we don't feel that we should be aggressive about doing a biopsy or doing additional study. We feel comfortable enough to see you back in 6 months. Now, this is your health, so we're going to have this discussion together. My personal opinion is that we should empower the patient to make her own decision. If you are a worry, you really worry about it, you have a strong family history, you can talk to us and, we can discuss it further. Okay. Number 4 is that I feel that it is suspicious. I'm not certain, and I would like to recommend tissue sampling, whether it's a biopsy or additional study like a breast MRI to find out more. Number 5 is that I am 95% sure or 95% or more certain that I believe it's cancer. It doesn't happen very often, particularly if you're getting your annual mammogram yearly. Hopefully we're not going to see number 5 ever. Number 6 is that you have a biopsy-proven cancer. We're seeing you as a follow-up, to evaluate respond to treatment or to see you right before surgery.
I see. So there's a lot of variants that you can see as a radiology team within a mammogram, and a lot of things that you're looking for.
Right. And when you get a result letter, we actually sit with you and we try to explain the whole process to you too. It's not like, okay, this is your result, and we actually will explain to you. We'll have you set up a follow-up appointment or a biopsy appointment on hopefully within a day or 2.
Do mammograms always detect breast cancer?
So mammogram is not perfect, but it's much better than physical exam. So mammogram is depend on your breast density. Breast density mean what is the ratio between, we call them a glandular tissue, like the tissue with the containing gland that produce milk for women, and fat that contain inside the breast. So if you had a lot of glandular tissue, it can hide cancer inside. So the sensitivity will decrease for those women. So it can be ranging from 60 to a 99%, depending on your breast density. So if you have dense breasts, we also are going to recommend that you get supplemental screening exam. We offer automated whole breast ultrasound at Adventist, and we can find additional cancer that way.
So the good thing is if there's options. So even if it may not give 100% result, there's other options that you could provide them to better diagnose breast cancer.
That's correct. So yes, and whole breast ultrasound is very straightforward. No radiation at all with ultrasound. So just to see better what hiding inside that breast.
One of the other things we typically hear is that people are anxious that it's painful. So are mammograms typically painful for patients?
Personally, I have a few mammograms myself. I don't find it painful at all. We do have to compress your breast, and the reason being that the more you can make the breast thinner, the less radiation we would need to penetrate the normal breast tissue and kind of spread out your overlying tissue. If we compress it a little bit more, tissue is not laying on top of one another. But the actual image acquisition, during the compression, it will last a few seconds. It does not last long, less than a minute. So after we compress you, we take a picture, you go out of compression.
So would you say it's more of a discomfort than
and
a pain?
brief period, very short time period.
And the benefit
Yes.
outweighs that temporary moment of discomfort for sure.
Yes, definitely.
One of the things we're trying to do today, Dr. Terada, is dispel some of the myths about mammograms and present our listeners with facts. And I know one of the things we might hear people say in terms of delaying a scheduling of a mammogram or not going at all is, hey, I don't have a family history, so I don't need to go at 40 or I don't need to go every year. What would you say to that?
So most breast cancer occur in patients who does not have family history Actually, 85% of people with new diagnosis of breast cancer do not have a positive family history. So I would definitely recommend that every woman over age 40 go in for her annual mammogram.
And another myth that comes up is, I'm doing self-exams at home regularly, so maybe I don't need to go in for a mammogram as often. And again, what do you miss there in the self-exam that you can find in imaging?
So a lot of breast cancer is not mass. A lot of time when you feel the mass, this means it might be kind of later stage of breast cancer. And a lot of time the mass you feel can be just your dense breast tissue. It's very important to get to know your breast, particularly if you're going to do cell exam, to do it regularly. But also as a radiologist, our goal is to detect cancer at the earliest stage, those that you cannot feel, so give you the best chance survival and like the least aggressive treatment possible.
And that's really what this is about. This is about that early detection, seeing things before they turn into something more serious while the cancer is still treatable, for sure. How would a woman know that she had dense breasts prior to coming in for a mammogram, right? Because that might not be something that anyone's ever told you.
Actually, that's a great question. You can't know. Actually, you cannot tell at all. Actually, there's no correlation between how firm your breasts feel and actually the breast density, how much you lactate, and about breast density. There's a lot of myth about it. But actually, it's the only way to find out is to get your mammogram. So it's determined on a mammogram, like it's dependent on how well we can see the cancer, basically. So there's a lot of breast, like not a lot of breast tissue, mostly fatty tissue, then I can see cancer well, and I would just assign it, not dense. But if I feel like there's a lot of white area that just can hide cancer, then that patient may be dense. So it's determined by a radiologist.
Okay. And this might be sort of in the same line of questioning, but what makes a dense breast dense?
So normally it's genetic. A lot of 40% of women have dense breasts. So it's not a small number. It's just what you're born with. The dense breast means you just have a lot more glandular tissue, like the actual gland, and actual fibrous tissue, like whether it's Cooper ligament, something that appear white on a mammogram. And it's just genetic. That's just how you're born and what your body made. Yeah.
And is there any, other than making it a little bit more difficult to see on the mammogram, is there any additional risk or anything that comes with having dense breasts?
So unfortunately, yes, because you have more glandular tissue. So you have more place for cancer to occur. So by having dense breast tissue, your lifetime risk for breast cancer increases, particularly for those with extremely dense breasts, like the very, very dense breasts. It can increase your risk by about 2 times. But I would like to stress, this is something that we can't do anything about, right? So there are modifiable and non-modifiable risk factor. We should really be focusing on thing that we can change, right? So would be and what good for the breast is good for the entire body, like exercise, not smoking, healthy weight, and no alcohol. Those are all the healthy stuff that you can do it, not just for your breast, but for your entire body. And they all lower your risk for breast cancer.
And so that's even more reason to make sure you're coming in for your mammogram, that initial one and all the follow-ups, is to make sure that you don't fall in that category of having dense or extra dense breasts and staying on top of it for managing that risk.
Completely.
So how would you say the mammogram technology has improved over the past many years?
Yes, we come a long way. So initially, mammogram was a film screen. You probably when you look at those doctor film and they print out the film and you put against the light, that's how it started. So we don't do that anymore. So right now, mammogram is viewed on a computer screen, and using we also have a 3D mammogram where we just not taking one pictures in a 2D dimension. We actually take over depend on your breast thickness. It can range from 50 to almost 200 images of just one breast. So we can see through all the different layer of the breast better. Beside that, automated whole breast ultrasound, make breast screening more convenient and much easier. We offer breast MRI in women with elevated lifetime risk of breast cancer. Insurance will cover your breast MRI if you have a greater than 20% chance lifetime risk of having breast cancer.
Those are great options, and I think technology has really kept up with a lot of the things that would help detect breast cancer and then help our patients towards the end.
How much of an obstacle is access and insurance and education in terms of getting women in for their mammograms? And what are some of the things that we're doing here at Adventist HealthCare to help with that?
So, luckily, I believe that it's a law now that mammogram should be 100% covered by your insurance. You should not have copay for your mammogram. Unfortunately, not the same thing for the automated whole breast ultrasound, but we have a discount rate for people with no insurance at all. We also have a lot of help that we can get through our coordinator. For example, we have a support from the Brem Foundation that can you allow to have a free screening mammogram, basically for women without insurance. And we can help you, plug in based on your need. Our coordinator sometimes even help patient apply for what program they're eligible to.
It's great we have that support and those resources and the staff that helps build the bridge there.
Yeah, I think sometimes just being aware of those options, takes away a lot of the obstacles that our patients may be already thinking about.
So if you're one of our listeners, they're headed toward 40, they need to schedule their first mammogram. They're a little concerned. What are some sort of words of encouragement that you can give about overcoming the fear of the discomfort or just the fear that something's going to be found and they'll have to deal with what's on the other side of that?
It's okay to be nervous because most people are nervous. I was nervous. And I'm a radiologist, so I see it every day. But when it's yourself, it's harder. So just communicate with your technologist. Tell them you are anxious. And, they train to make you more comfortable. We're happy to talk to you, and we can review the result with you if you requested as well. And remember why you're doing it, because you're taking a powerful protective step for your long-term health. This short exam can save your life. And you can treat yourself afterward, just make it an experience. And just bring your friend, bring your mom or your sister to come together. It can be something you can do together. And it's really powerful, I think.
I love that idea, too. I love the idea of bringing your sister or a girlfriend and sort of making it into something that's joyful and positive and good for your health and your relationships, and making something that could be scary or drudgery or whatever into a nice moment. So I love that advice.
Dr. Terada, if you have one advice for our listeners, what would that be?
I think the most important just to come and just, and it's really a fast exam, easy exam, and tell your people, your friend and your family, those who you care about, just to come for your annual mammogram. It's important. And it doesn't take long. It could be life-saving.
I love that message because we probably have a lot of listeners that are on top of their health as, they're listening to this podcast, right? And I think it's so important for all of us to be ambassadors for regular screening, for the mechanisms of early detection. And as someone who has used Adventist HealthCare's breast center, can really say the staff there is top-notch, super compassionate, and makes it as easy of an experience as it can be. So thank you for all you do and all the team there at our imaging sites do to get women and their loved ones through, whether it's a routine screening or there is something that is detected.
I just want to thank Dr. Terada for sharing her expertise in today's podcast. For our listeners, remember, 1 in 8 women are affected by breast cancer. So if you want to learn your risk for breast cancer and your personalized screening recommendations, take our breast health risk assessment at adventisthealthcare.com/takeyourgirlsout. A bonus, if you complete it in the month of October, you'll be entered to win a prize. So if you're due for your annual mammogram, don't wait. Adventist HealthCare Imaging offers convenient locations across Montgomery County. Schedule your mammogram appointment today at yourbreasthealth.com. Remember, early detection is the best protection.
We would also like to hear from you. Let us know if you like the podcast by leaving a review, or you can email us at podcast@adventisthealthcare.com.
Don't forget to subscribe to the podcast so you can get new episodes. Thank you and be well.